Thank you, Deputy Presiding Officer. I welcome the opportunity to speak in this morning's debate on the NHS and the independent sector on the motion brought forward by Mary Scanlon. Before turning to the substance of the motion, I would just like to pay tribute to Mary Scanlon for the amount of work she does on health issues and also on other issues throughout the Parliament. She really is a credit to the Conservative group. The motion obviously specifically deals with the NHS and the independent sector and makes specific reference to Stracathro and the success of the Scottish Regional Treatment Centre there. That centre obviously was opened in 2006, and indeed its opening was welcomed by Shona Robson, who represents the SNP on the front bench today. I think at the time it was put forward as a solution that met local needs and has been successful in reducing waiting times and helping patients, and from that point of view is to be complimented. Obviously that was a solution for the east of Scotland. The Labour amendment quotes a solution used in the west of Scotland, where the Golden Jubilee was taken back into NHS control. This is becoming a very modern hospital. I give way to Nanette Milne.
That the NHS could have used the facilities of the Golden Jubilee Hospital for its patients without actually buying it from the public sector, and that the money used for this, from recollection, I think it was at least £35 million, would have been better used for frontline services.
Mr Kelly.
In looking at the development of the Golden Jubilee since that decision has been taken, and actually speaking to patients, there is no doubt that patients feel that development has been very worthwhile, and it has had a practical benefit in improving the health care for those that have attended the Golden Jubilee at Clydebank. Indeed, one of the big issues obviously in the west of Scotland is heart disease, and I think it's to the benefit of the west of Scotland to have a facility like that within public control. There's no doubt that in looking at the challenges facing the NHS, this Conservative motion talks about the importance of achieving the best possible health care for all of Scotland. And there are many issues before the Parliament that we have to face up to. There's no doubt that there are issues around health inequalities and in improving access to all in the health service, and also in terms of treatment of cancer patients. I, along with other MSPs, attended the Scotland Against Cancer conference last Friday in Glasgow, which was attended by clinicians, patients and politicians, and we heard a number of presentations and workshops that spoke about the importance of diagnosis, of treatment and of lifestyle choices. There's no doubt in looking to try and come up with solutions to some of the issues addressed in that workshop, then we've got to, first of all, remember the importance of the staff of the NHS and retain the staff and the expertise in the NHS, as the Liberal Democrats have acknowledged in their motion. I think there's no doubt that the Scottish budget, with a third of the Scottish budget at the disposal of health and wellbeing in excess of £10 billion, it shows the size of the resources that we have, but also shows the size of the issues that we have to face. In terms of deploying that budget, I certainly believe that the default position should be to retain a publicly funded NHS. But in facing such challenges as I've outlined, I do acknowledge we shouldn't be completely inflexible, and if there are instances like the Scottish Regional Treatment Centre, we should look at other mechanisms. In summing up, Deputy Presiding Officer, there is no doubt that we should put patients first. The NHS was 60 last year. It was a tremendous creation by Aneurin Bevan. We must maintain that, consolidate it and build on it, and ensure that we give it another successful 60 years.